Guys, welcome back to Pioneer Hair Transplant Clinic. Now, we got an interesting case today. This patient has actually a front side broken hairline and crown area also completely bald. For this kind of patients, what we are going to deal with, how we are going to deal with, and what kind of results we are going to get, what is the plan? So we are going to discuss in this video. Well, this patient, I don't go by the classification like class 4 or class 5 or class 6 because here most of the things, most of the patients will not fall into that category, whether class 2, class 3, class 5, because what kind of head size, what kind of this baldness is spreading. So if you can see in this patient, usually broken hairline and backside crown area is totally lost and is burrowing to the front. Probably you would end up in class 6 sooner or later. So this doesn't fall to the kind of a typical class 4 or class 5. But here I would consider the area of the baldness and availability of the donor and what are the patient goals. These three factors, I tailor the plan for this patient irrespective of by looking at the classification. That's what this patient is very intrigued for any surgeon or any patient too. That's what we're going to discuss in detail and how we achieved the best results we are showing in this video. This guy, age around 29 years, approached us with the baldness of having a frontal broken hairline and crown area baldness also. If you can observe this patient, here the tricky part is, this comes under probably class 4 or class 5 baldness, but kind of sooner or later he'll end up in a class 6 baldness. However, here important point to be noticed is, there is a front side remarkable receding hairline where broken hairline is there. That means you need to get it rectified, frontal area. And there is a huge amount of hair loss and baldness in the crown area which is burrowing to the front. So that also has to be rectified. These two portions, front and back, rectifying at the same time is not a joke, because crown alone itself, we need more grafts and maybe second chest also required. So in such cases, planning is very important. What kind of plan we did in this patient is, the planning, when it comes to the planning, we rectified or we implanted good grafts in the frontal hairline to give you a best look. That means someone looks for the front or sides, is supposed to get a best appearance and best look. And that's the main motto. At the same time, if you don't cover the crown area, it looks so bad. So we implanted more grafts in the crown also. In one session, we could able to achieve best results with the best plan. That's what the highlight of this patient. So if you can see the crown area as well as the frontal area, a remarkable change happened after 9 months after the transplantation. Well, what kind of challenges a surgeon or doctor faces when you handle this kind of patients? There are two perspectives. Number one, from the patient side, patient will simply tell you, I need hair everywhere, front and back. On doctor's side, what are the challenges? Like, you need to implant both front and back. There never ends the story, and crown always requires second time. And you are distributing the grafts front and back. That means you would need more and more grafts in the crown. And another adding point is, probably you would lose more hair in the mid scalp. And these are the three challenges. Number one is, you are distributing one session, implanting front and back, which is not good. So that means you would need definitely second session. And second point is, where a patient would never expect that probably you would lose more hair than you need one more session. So by keeping all this in our mind, planning is most important. What is the plan in this patient is, one should understand, we should not waste grafts unnecessarily. That means we need to conserve the grafts because graft number is limited. So we need to make such a hairline, it should look very beautiful with that, so no one should understand than a transplant. That's one thing. Little higher hairline we can take because there is ongoing hair loss. That's the reason. There's no point we are wasting more grafts in the frontal area. Kindly remember, most of the transplantations would go failure not because of the surgery. It's because of the wrong plan. It is because of the wrong plan the surgeries goes failure. Implanting in the wrong manner, wrong place, definitely would end up in a disastrous outcome. So here we made a meticulous plan by utilizing less grafts in the frontal hairline, to achieve the best hairline design, and we implanted well in that frontal area and we achieved the best outcome. And in the crown area, we need to implant the same way the directions, angulations, however the natural hair exists, so that we can achieve very natural way of getting more density and better camouflage. That's what we achieved in this patient in single session, both areas front and back. So, well, if he loses more hair, I'm sure we preserved more donor for his future transplantation, so that we can do future transplant also. These are the few challenges from the doctor side we do have in handling such patients. And number two is, what are the challenges from difficulties from patient side? Patient side problems in this kind of patients are, usually they think that I'm undergoing one transplant, fine, I would get results everywhere. He doesn't know that he's going to lose more hair, and probably I would simply say I want front and back both, and what about mid scalp in future? So he should be motivated to understand this kind of patients, probably we would lose more hair, so that we don't want to waste more hairs. Kindly go with the surgeon choice and doctor choice. We should talk to the doctor, what are the ongoing hair loss and what are the future complications and consequences would I get it if I implant unnecessarily in the front. All this has to be discussed well in advance before surgery to arrive at best decision to get best results. All matched in this patient, like patient motivation, perspective, and our guidance and our meticulous implementation of the plan all went very well and arrived at best decision, and we did a transplant. We could achieve best results. We achieved very good results in this patient. After 9 months, you can see the crown area as well as the frontal area. It's fantastically improved, and with a different style. And if you can see the backside also, best donor management we have given in this patient. And that's what the highlights of this patient, and that's what the quality transplant. That's possibly the only expert's hands, and that's the results we would like to show today in this kind of intrigued, interested patients. Thanks for watching.